I want y'all to think back to pandemic days. Y'all remember those NK95 or N90 masks that we needed to wear when we were out in public? I hope y'all have some left over from the pandemic days. If you don't have any, I would suggest you get you a few boxes, especially if you are in the state of Florida, because on yesterday, Florida made this announcement.
What a crowd! Thanks so much. And, I think about something like, newborn baby, do they need that hepatitis shot? It's like, what's the rationale for it? I mean, we know how you can get that. Okay, so a baby needs that. And then if they do it, are there drawbacks for it? And usually they just tell you there's never a drawback for anything. Let me tell you, anything you take could have a potential drawback. I mean, that's just the reality. But today I'm pleased to announce the establishment of the Florida MAHA Commission as a working group which will recommend state-level integration of these Make America Healthy principles. And those principles are, as I mentioned, individual medical freedom, informed consent, parent rights, and also market innovation.
The Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. All of them. All of them. It's wrong. It's immoral. They do not have the right to tell you what you put in your body. So people are going to have to make a decision. People are going to have to choose a side. And I am telling you right now that the moral side it's so simple. No one has that right, guys. People have a right to make their own decisions, informed decisions. You want to put whatever different vaccines in your body, God bless you. I hope you make an informed decision. You don't want to put whatever vaccines in your body, God bless you. And I hope you make an informed decision. And
vaccines will no longer be mandated in the state of Florida. So I went on over to Alfred and I asked Alfred, what are the risks of removing mandated vaccines in the state of Florida or in general? Removing mandated vaccines in Florida or elsewhere carries substantial risks, including increased outbreaks of vaccine-preventable diseases, threats to vulnerable populations, and undermining decades of public health progress. Increased disease outbreaks. Eliminating vaccination requirements for schools, daycares, or general populations can lead to dramatic drops in immunization rates, raising the likelihood of outbreaks from diseases like measles, polio, and chickenpox. Outbreaks often target unvaccinated individuals and can spread rapidly within communities, especially where herd immunity has declined. Increases threats to vulnerable populations. Many individuals, including infants, the elderly, and those with immune deficiencies, cannot be vaccinated for medical reasons and rely on high community vaccination rates for protection. Removing mandates places these groups at heightened risk of severe illness or death from otherwise preventable diseases. Public health concerns and safety. Vaccine mandates have been credited with nearly eliminating certain diseases and protecting millions of lives over the last several decades. Abandoning these laws may make entire regions less safe to live in or visit and can have ripple effects beyond state borders due to travel and disease transmittability. Socio and economic consequences. Disease outbreaks disrupt schools, healthcare systems, and local economies due to increased hospitalization and absenteeism. The erosion of vaccine requirements may also undermine public trust in government and science and increase misinformation and polarization. Local context for the state of Florida. Florida's move to end all vaccine mandates would make it the first state to do so nationwide. Public health authorities, pediatricians, and national organizations have expressed alarm, warning of severe risks for children and communities and possible ripple effects across the United States. In summary, removing mandated vaccines jeopardizes both individual and public health by increasing disease risks and undermining community protections that have proven effective for generations. Now, I know you think, thank God I don't live in the state of Florida. I want to remind you that RFK Jr. is the health secretary for the United States of America. And he had to show up to testify in front of Congress today. Here's a snippet of how that went.
Economy is an incredible accomplishment. Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
Okay, then let me ask, because you also
Senator, I just want to make clear, I did not say that.
We'll check the record. That's a question of fact. You also said that you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine. Again, it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access. An email from a physician friend of mine, hey, Bill, I'm not even sure what I'm asking you, but we're all confused and concerned about who can get the COVID vaccine. We are having our attorney try and render an opinion, but there's no firm guidance and concern about liability if vaccines are given to a patient who requests it, but not on the current CDC list. Pharmacists are requiring a prescription now even for patients over 65, creating a huge headache. I submit these for the record.
Without objection.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
Thank you, Mr. Chairman. Following up on that same line as
Financial conflict of interest. It's not a financial conflict of interest.
Let me finish up. You also told Senator Wyden at the outset that you didn't want to take vaccines away from people. And as I conclude, I would like to say this. Because of the conflicting recommendations made about COVID, this is from Eric Erickson, good conservative out of Atlanta, Georgia, occasionally gives me help. My wife has stage 4 lung cancer. She is one of the people the COVID vaccine actually helps. Thanks to the current mess at HHS, CVS is unable to get her vaccine.
Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children in the future? Yes or no, Mr. Kennedy?
And Dr. Malone is one of the inventors.
Yes or no? Yes or no? Were you aware that he had that view when you appointed him to this panel?
Dr. Malone is one of the inventors. As I said, Dr. Malone is one of the inventors of the mRNA vaccine.
That's not
so he knows a lot more about it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made, just as it wasn't true when you wrote that, quote, African AIDS is entirely different from Western AIDS. Are you aware that another one of these new members, Dr. Levy, wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people? Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it? It's not true. It wasn't true when he said it, and it's not true when you said it. Secretary,
all like rearranging deck chairs on the Titanic. If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. This was their job to keep us healthy.
Thank you,
And I need to fire some of those people to make sure this doesn't happen again.
Thank you, Mr. Secretary. I have to.
Yeah. It's not just the residents of the state of Florida. It's all of us. Our health is in danger now. So, I'm advising my elderly mother to make sure she masks up when she leaves the house. And I think we all need to do the same. They trying to kill us.